Hello and welcome back. We are very excited about our next presentation that is focused on the connection between the gut and the nervous system. In this presentation, Dr. Caviola is going to cover the different pathways and how changes in our gut microbiome or integrity can lead to or aggravate neurological conditions, neuroinflammatory conditions, and neurodegenerative conditions. This is a topic that is unfortunately overlooked in the mainstream approach, and it allows us to have a deep insight of what are the root causes, some of the root causes that patients might have when they're coming to see you with neurological or mood disorders or neurodegenerative conditions. And so allow me to introduce Dr. Matthew Caviola. He's a naturopathic physician with 15 years of experience in the field of integrative, nutritional, and herbal medicine. He specializes in nutritional medicine, detoxification, and men's health. He received a bachelor's degree in biology and a master's degree in human nutrition from the University of Delaware, a master's degree in acupuncture, and a doctorate degree in naturopathic medicine. He has been practicing as an integrative medicine physician for over a decade now and was also an adjunct professor in several colleges such as Southwest College of Naturopathic Medicine, as well as assistant professor at Bastyr University. I hope you got a notepad and a pen ready to take some notes, and I hope you enjoy the next presentation.
Hopefully this presentation helps to give you some more insight about the gut-brain axis, and it's truly a fascinating topic, and I'm very excited to be presenting this topic and give you some information, some new information, some research on the topic, and also a couple of really interesting case studies at the end of the presentation to hopefully shed some light on this and be able to give you some clinical pearls to take into your practices now and in the future. So here, as we move from the oral direction towards the anal direction from top to bottom, again, we have distension, right? Something, the luminal contents the lumen is expanding. There's something coming down the chute. And that, of course, causes these IPANs, the sensory neurons, to become activated. They are connected, as you can see here, to multiple different neuron types. We have the excitatory motor neurons, and we also have the inhibitory neurons as well, that basically cause either contraction or relaxation. And there's a variety of neurotransmitters that actually aid in that functionality. As you can see here, acetylcholine is extremely important. Nitric oxide is here, a vasoactive intestinal peptide is here, ATP is in here. So we need a lot of neuropeptide YY is on here. So we need a lot of different neurotransmitters to make sure that we can contract and relax properly, right? Excitation, inhibitory. Excitatory is contraction. As you can see, relaxation is inhibitory. So that needs to happen all along the gut until we move the things down properly. You can see we have two layers of muscle, circular muscle and longitudinal muscle. That is what aids in peristalsis. That is what causes peristalsis to happen normally, right? This excitation wave, contract, relax, until something is completely moved through the intestine. Pretty fascinating stuff. So this enteric nervous system is involved in that, and it's all set up by this cascade reaction where we have distension that causes the neurons to work properly. We also, again, have secretory neurons as well that are going to be involved in this to secrete a variety of substances, including neurotransmitters. Okay, so there were multiple studies, or there have been multiple studies, I should say, that have demonstrated this from a kind of an earlier standpoint, kind of all the way up to now. Now there's, of course, thousands and thousands of research articles that are coming out looking at this relationship between the gut and the brain, the central nervous system, and the microbiome. So for example, there's 5 studies here that were conducted relatively early in this research that kind of demonstrated this relationship. Studies in germ-free animals showed that the brain is affected in the absence of the microbiome. Just fascinating. So germ-free animals, they don't have a microbiome, and that affected their nervous system functionality. Really interesting. Animals, given specific strains of bacteria, had alterations in their behavior. And human studies of such strains confirm the potential translatability of such findings. And we see this a lot with respect to behavior. We see it with respect to a variety of mood disorders, including anxiety and depression, and even bipolar and schizophrenia. We'll talk about a couple of these things today. That there's direct relationships, and in the realm of ADHD and autism as well. Behavior correlates to the microbiome, and specific strains can cause specific reactions, specific emotions, anger, aggression, those types of things. It's really fascinating. Population-based studies of people exposed to infections, most notably in Canada, demonstrated alterations in gut-brain symptoms. So people exposed to infections had gut-brain symptoms. Preclinical studies with antibiotic administration, either in early life or adulthood, have shown long-lasting effects on the brain, spinal cord, and the enteric nervous system. And again, we'll come back to this many times throughout this lecture, looking at the relationship between antibiotics, the microbiome, and how it affects the gut-brain axis. Patients with hepatic encephalopathy had dramatic improvement in their health after being given antibiotics. Well, that's interesting. Some of these folks actually have dysbiosis that could be contributing to the encephalopathy, and that can make some of their symptoms better. And that is one instance where antibiotics, of course, there's many instances as well, where antibiotics can actually have a positive role in this gut-brain axis. It's not always bad, of course. All right, so the microbiome and the brain-gut axis relationship, it's all connected. Evidence indicates that there's a bottom-up modulation of the central nervous system by the microbiome, which occurs primarily through neuroimmune and neuroendocrine mechanisms, often involving the vagus nerve. So there's some kind of bidirectional crosstalk between the two systems, and it might happen primarily because of the microbiome and what the microbiome is making and synthesizing. So it's mediated by, again, microbially derived molecules. This includes short-chain fatty acids, secondary bile acids, and tryptophan metabolites. These molecules propagate signals primarily through the interaction with two different types of cells, the enteroendocrine cells, the EECs, and the enterochromaffin cells, the ECCs, and the mucosal immune system. So some of these molecules that the microbiome produces cross the intestinal barrier, they enter the systemic circulation, and may cross the blood-brain barrier. So there's a direct connection. It remains poorly understood if the molecules reach the brain sites directly or only induce central responses via long-distance neural signaling by vagal and spinal afferents. So the afferents are going towards the brain, towards the spinal cord, right? And so it's kind of unclear at this point in time in terms of how exactly it happens, but we do know that there is crosstalk. The microbiome can independently produce or contribute to the production of a number of neuroactive molecules, including but not limited to GABA aminobutyric acid, 5-HT, which is serotonin, norepinephrine, and dopamine. It's unknown if they reach relevant receptors or achieve sufficient levels to elicit a host response. But again, the most important thing is that they independently produce or contribute to the production of different types of neurotransmitters. Let's look at short-chain fatty acids. I'm always fascinated by this topic. Again, another topic that I'm fascinated by. They have been implicated, short-chain fatty acids, as major signaling molecules, which help to mediate host microbiome communication via those different types of cells we just talked about. Short-chain fatty acids, for those of you who don't remember, are generated by microbial fermentation of human dietary resistant starch and non-starch polysaccharides. So we make short-chain fatty acids by fermenting starch. Okay, that's very important. They serve as an important part in the host's energy harvest, while also stimulating colonic blood flow, fluid and electrolyte uptake, and mucosal proliferation. We need to have short-chain fatty acid production to aid in the health of our intestines and the gut, and a variety of other things as we just mentioned. So that's important. Dietary fiber intake is a major regulator of short-chain fatty acid concentrations. Without fiber, we don't make short-chain fatty acids properly. In instances in which the host diet is low in fibers, the microbes actually feed on mucus glycans, that mucus layer that we were just talking about, and use alternative, less energetically favorable sources, resulting in reduced fermentative activity and short-chain fatty acid production. That's not what we want to happen. We want to have abundant short-chain fatty acids because they do a lot of things. Preclinical and clinical data has shown that microbial activity, in particular the production of short-chain fatty acids, helps to stimulate a variety of different cell types, including L cells located at the distal ileum, to secrete multiple different types of substances like peptide YY and GLP-1, which actually induce satiety and behavioral changes. Well, that's interesting. So when we have enough short-chain fatty acids, it's important also for satiety, for preventing obesity, for regulating the metabolic system to some degree. Really, really cool. And then, of course, it also has relationships with the gut, with the brain as well, and helping with behavior. So serotonin is produced by the enterochromaffin cells of the GI tract. 95% of the body's serotonin is stored in these cells and the enteric neurons. And 5% is stored in the central nervous system. We forget about that. This is very fascinating because when we come back to this concept of neurotransmitter testing, we can actually look at some of these things that show up in the urine. We have to kind of extrapolate the information because a lot of this stuff is stored. Serotonin's central role in regulating GI motility and secretion. Of course, it has a central role in regulating those functions. There's likely immense selective pressure on the gut microbiome to act on the serotonergic system to modulate their environment effectively. So this is a commensurable kind of world. They want to make this is a two-way street that can influence regional transit times and fluid secretions as well. Short-chain fatty acids and secondary bile acids, also derived from spore-forming bacteria of the gut, regulate a significant percentage of the serotonin synthesis and release. So here we have this IBS conversation in terms of what's happening downstream. So we have our microbiome here. We have bile acids and the microbiome and of course short-chain fatty acids that are being produced. And if we do end up with intestinal permeability, that of course is going to maybe start off this entire cascade. So the tight junctions are damaged. You can see that it's opened up these pores here. And one thing that's not talked about a lot in the realm of IBS is the fact that mast cells are oftentimes activated. And mast cells, of course, are one of our major cells that are involved in allergic responses and hypersensitivity responses. And that could be partially what's responsible for some of the pain signals and the visceral hypersensitivity signals. So they release histamine and other things like proteases. And as you can see here, these mast cells, when they release this causes the stimulation of the extrinsic visceral afferent neurons, which go directly to the brain and spinal cord, and that causes this visceral sensitivity down here. So that is kind of what I was alluding to. So this visceral sensitivity could be driven in part by the release of histamine from mast cells. So that's something to think about from a treatment perspective. How to prevent histamine degranulation from the mast cells. The other thing that is important when we look at this diagram is that we also, of course, have downstream, we have the release of a variety of intermediaries, including substance P. Substance P is involved in pain. And so that when we have enough substance P being released, that can also cause visceral sensitivity as well. And we also have the activation of the immune system here. We have lymphocytes, we have macrophages that are activated, and that, of course, these guys can produce a variety of cytokines, including IL-1 and 4 and 6 and 10, tumor necrosis factor alpha, interferon gamma. All those things are very common when it comes to systemic inflammation. And we see this a lot. Patients who have IBS oftentimes have systemic inflammation. They have inflammation locally in the gut, but they also have systemic inflammation as well. So I find this extremely fascinating, especially with relationship to the visceral sensitivity issue that a lot of folks have. No discussion of the brain-gut axis would be complete unless we talked about neuroinflammation. Just as we just talked about inflammation locally in the gut, we can also have inflammation in the brain. And the spinal cord. And this is mediated by the production of these things we just talked about: cytokines, chemokines, reactive oxygen species, free radicals, and also secondary messengers. So these include the cytokines IL-1B, IL-6, tumor necrosis factor alpha, the secondary messengers, nitric oxide, and prostaglandins, and activation of the brain's innate immune system. That's basically what happens, right? The brain is like, there's something going on here. So it activates the immune system. The degree of neuroinflammation depends upon the context, duration, and course of the primary stimulus or insult. So of course, there's varying degrees of neuroinflammation depending upon how long it's been going on and what's causing the neuroinflammation to begin with. The inflammation can lead to the recruitment of immune cells. It can lead to edema in the brain and in the cerebrospinal fluid. It can cause tissue damage and potentially neuronal cell death. And that, of course, is the biggest danger with respect to neuroinflammation, is the loss of brain function and the loss of plasticity. So there are a variety of chemical mediators produced by resident glia, the microglia and the astrocytes, endothelial cells, and peripherally derived immune cells. So these chemical mediators, of course, can cause that inflammation and down the line cell death as well. And we do know now that this neuroinflammation is a key pathological driver of a variety of neurological diseases, including neurodegenerative diseases, psychiatric problems, pain syndromes, stroke, and traumatic brain injury. So now we want to know, is there a link between neuroinflammation and the brain-gut axis? It's a resounding yes. And there's emerging research demonstrating that the gut-brain axis and the health of the microbiome may be one of or the missing link in the pathogenesis of neuroinflammation, neuropsychiatric, and neurodegenerative diseases. So dysfunction of the brain-gut axis has been associated with psychiatric disorders, including depression and anxiety. We'll talk about those, as well as neurodegenerative disorders, including Parkinson's and Alzheimer's disease as well. In physiological conditions, the glial cells are determinants in the regulation of brain development, neuronal activity, and survival. So the glial cells are very important when it comes to making sure that we have a healthy brain and a healthy gut too, as we just talked about. The microglia patrol the brain microenvironment. They're kind of like the police of the area, making sure that we can have good defense against bad guys from exogenous pathogens or even endogenous dangers as well, even large food particles. In response to bacterial and viral infections or brain damage, the microglia are rapidly activated and they phagocytize pathogens, meaning they engulf them and try to neutralize them. And this includes amyloid beta, which of course has been shown to be one of the pathogenic features of Alzheimer's disease.
So if you're interested in expanding your understanding of the gut function, the microbiome, and the connection to chronic conditions, if you're interested in learning how to evaluate if your patients have gut dysfunction or dysbiosis that is aggravating their conditions, and the treatment protocols with specific nutritional guidance and supplements, and if you're interested in learning about the gut-brain axis or the gut-skin axis and how to treat it, then I invite you to this evidence-based conference with experienced clinicians. You will also receive all the clinical guides and the presentation handouts, and will also include all the presentation recordings so you can re-watch it again if you're interested to learn and gain more knowledge. Now, we have limited spots for this unique one-day conference, so I highly recommend to register now and save your spot. Thank you for watching, and I'll see you there.